Well, thank you so much for having me here, and very excited to open up this Moonshots for Health conference. Again, this is Sami Inkinen, CEO and co-founder of Verta Health, and I also just got the numbers that nearly 5,000 people have signed up for this conference, which I'm very excited about. And seems like we have a lot of health plan participants, benefits leader participants, benefits consultants, and just people from the general population. So very exciting. So I was going to share a little bit about what are we doing here? What do we talk about Moonshots for Health, and what's our focus, and perhaps a little bit what's my own personal role in trying to solve these problems. Well, this conference, Moonshots for Health, is specifically focused on trying to address the chronic disease epidemic, particularly type 2 diabetes and obesity. Why focus on type 2 diabetes and obesity and related chronic diseases? Well, my and our take is, sadly, we are in a process of absolutely losing the war on type 2 diabetes and obesity. It sounds like a very negative way to start, but that is the challenge we are facing. And that's why we wanted to organize this conference, that we would apply some real out of the box and moonshot thinking to try to solve these challenges. And why do I say we are in a process of losing the war on type 2 diabetes and obesity? Well, let's look at some statistics, and let's start from type 2 diabetes. This chart here is the percentage of Americans living with type 2 diabetes. And today we are sitting at around 8%. That's 8% of diagnosed type 2 diabetes among adults. And sadly, this has more or less 10x'd in the recent history. And when we look forward, the prevalence of type 2 diabetes is expected to again double to 16% over the next decade. And those of you who love reading New England Journal of Medicine, like I tried to, just a couple of months ago, there was an article and analysis on type 2 diabetes care and outcomes over the last decade in America. And over the last decade, according to this analysis, we had made no progress in type 2 diabetes outcomes in America, which is, sorry to pile on the negative news here, but of the billions, hundreds of billions invested and spent a year on type 2 diabetes, in America alone, we had made no progress in type 2 diabetes outcomes over the last decade. So that's type 2 diabetes. So our take is, to make a change, to improve the situation, you really have to do something differently. You really have to apply moonshot thinking. So that's type 2 diabetes. And sorry to deliver more bad news, why we are losing the war on type 2 diabetes and obesity. But let's look at obesity rates in America, or the percentage of people living with obesity. It's a lot of data and information on a slide, so I don't go into the very details, other than just mention that over the last couple of decades, we have increased the rate of people living with obesity in practically every single state in America. And today, when we are looking at the adult obesity rate, nearly half of American adults are living with obesity. So similar to type 2 diabetes, no matter what numbers you look at, no matter what statistics you look at, it is impossible to make a case that we are somehow winning the war on type 2 diabetes, obesity. And here's just another way to make the same case. If you see green, yellow, orange, or red on the map, it's bad. and those are the only colors you see. So the obesity rate among American adults just keeps growing and growing. So that's why we chose the focus for this Moonshots for Health conference around chronic disease, and particularly type 2 diabetes and obesity. We have to do something differently. We are badly in the process of losing the war against type 2 diabetes and obesity here. So can anything be done? It would be easy to stop here and say, looks bad, this train is just gaining speed and there's nothing that can be done. So I wanted to introduce some optimism by sharing 3 examples that, at least in my own mind, are very remarkable examples of achievements in battling epidemics or pandemics. And I will start from polio. And I hope many of you listeners know that just a couple of decades ago, more than 1,000 children were born with polio every day, every single day. And today, we've literally eliminated polio from planet Earth. Or to be specific, I think there's 2 countries in Africa where there have still been some cases, but we've literally gotten to a point where polio virus does not exist. And as an anecdote, I remember growing up in Finland myself. I think I was a first grader, and I took this sugar cube that had the polio vaccine myself. And to me, this is a remarkable example. Now, it didn't happen by one company or one person. It took a society-wide effort, massive investment globally, and real focus on this challenge. So anything is possible when we put our minds and hearts and resources and focus. Nearly anything is possible. And I admit it's a viral infection. It's not exactly the same as type 2 diabetes or obesity, but anything is possible. The second optimistic example I wanted to share is a very timely, and I know we are sadly still in the middle of battling COVID-19. And I think everyone has an opinion what should be done differently. However, I would argue, and I think most, if not everyone, would agree that both in the US and globally, we've done a phenomenal job in developing a new vaccine from scratch and getting it to the marketplace at the speed never seen before. And again, all of us would likely want the vaccination rate to be much higher, but today, in just a matter of months, we've globally delivered, or more than 2 billion people have been fully vaccinated against COVID-19. And in America alone, it's well north of 100 million people. So whatever else should be done in the future, and a lot of things should be done and differently. It has been a remarkable effort to develop a new vaccine and get it into the bodies of so many people. So I thought that's another positive example that nearly anything is possible as long as we put our efforts and collective focus on it. And then the third positive example that I wanted to pick is a little different, because admittedly COVID-19 and polio are viral infections. And I think we would agree that type 2 diabetes and obesity are more on a lifestyle disease front, which is not the same as identifying the virus, developing vaccine, and getting the vaccine to the people. When you talk about lifestyle disease, there's a lot of behavior change involved. So I wanted to take something that's somewhat similar to the chronic disease epidemic we are battling, and that is smoking. At least to me, it was mind-blowing to look at the statistics when I was digging into it, that just a couple of decades ago, nearly half of American adults, and sadly also kids, were smoking. And here we are today, we are close to about 10%, there's still ways to go, but only 10% of Americans, adults, are smoking. Now, this is remarkable progress. It did not happen in a year, not even in a decade. It took many decades. But this is an amazing outcome. And when you look at that line, it's nicely coming down. That's what we would like to see with type 2 diabetes prevalence or obesity prevalence. And hopefully, by applying moonshot thinking, not just by one person, one company, or two companies, but society-wide, we will be able to achieve these type of results in chronic diseases such as type 2 diabetes and obesity as well. So there's a little bit positivity from the polio, COVID-19, and then battling smoking epidemic. And hopefully we can apply some of those learnings as we look into chronic diseases. So I already introduced myself as the CEO and co-founder of Verta Health, and you might wonder, well, it's easy for you to talk. What are you doing about, what's your moonshot? What are you doing about these chronic diseases? So I thought to share a little bit about my own role and efforts and reasons behind addressing type 2 diabetes. So my personal moonshot around addressing chronic disease is reversing type 2 diabetes. And I admit, if somebody had told me or asked me, let's just say 7 years ago, that you should go and start reversing type 2 diabetes, that's possible, you should go and make it happen, I literally would have laughed that person out of the room. I would have laughed that person out of the room because to me personally, and this is embarrassing to say, I'm not proudly announcing my point of view here, but that's how I was thinking. My point of view was type 2 diabetes, obesity, and the many other chronic comorbidities are diseases where people already know what they should be doing. They just don't do it. It's behavior change. People know how to live, quote unquote, healthy. They just don't do it. How do you solve that? It's impossible. Nobody has done it. It's not going to happen. So that was my thinking. But here I am sharing that my moonshot is to reverse type 2 diabetes at scale. So what changed? So just briefly, my personal story, it's kind of behind the picture on the left-hand side here. So that's a picture of me in a triathlon outfit, in fact, winning the world championships in triathlon in my age group, 2011. And the reason for the photo is that soon after the photo was taken, to my shock, I discovered that I was pre-diabetic and on my way to becoming type 2 diabetic. And I thought, no way, it's not possible. I am one of those people who knows what to do, and I also do it. I'm lean, I'm exercising a lot, I'm not gaining weight, I don't need too much. And this experience kind of changed my point of view and also led me to this gentleman on the right here on the slide, Dr. Stephen Finney, who then became my co-founder at Verta Health. And Dr. Finney had done a research on metabolic health and diabetes for a long, long time. And he said, hey, there's one thing we aren't taking the right way in addressing type 2 diabetes. And that one thing is, it's not just about how much you eat and gaining weight, but it's as much about what you eat. And consequently, if you provide the right information, if you have the right protocols, if you provide the right support, which would be or became possible with technology, you could actually reverse type 2 diabetes. And I became convinced that that's possible and decided that that's my personal moonshot in addressing chronic disease. And so my personal moonshot since around 2014, now 6-7 years, has been to reverse type 2 diabetes. And not to go too much into detail here, but reversing diabetes, type 2 diabetes, is just fundamentally different in how to address the disease, because the traditional view is type 2 diabetes is a one-way street. Once you get it, it's progressive, it's chronic, and the best we can do is to slow down the progression, by prescribing more and more medications. But you're still only slowing down the progression. And when reversing the disease or putting it into remission, which is another term for the same thing, is achieving glycemic control or blood sugar control that makes the patient look normal. Blood sugar comes down, and consequently, even the need for medications can be eliminated. So that's my personal, hopefully, contribution to this chronic disease epidemic, and my personal moonshot to reverse type 2 diabetes, not just in 1 or 10, but 100 million people. And that's the mission that we at Virta Health are. And I would love to be able to declare win over type 2 diabetes. We aren't quite there yet, but the results, both from our prospective clinical trial, working with hundreds of large entities from employers, health plans, even government entities, is very encouraging. And I've absolutely become convinced that type 2 diabetes reversal is possible. It's going to happen at scale, and that is one way in which we can really solve the type 2 diabetes epidemic. So again, that's my personal moonshot, and there's a lot more work to be done, but hopefully we will be able to make some sort of a dent in the type 2 diabetes epidemic, not just in the US, but globally. So lastly, I wanted to cover a little bit about the conference and what's ahead of us. Again, focuses on chronic disease, particularly type 2 diabetes and obesity, and solving those. And solving them, we believe, takes moonshot thinking. We collectively, not just in the US, but globally, we've tried kind of repeating the same old thing for the last 1, 2, 3, perhaps 4 decades. Incremental progress, putting more money into the same old approaches. Our take is, and perhaps this is the old Einstein quote, the definition of insanity is to do the same thing over and over and expect different results. And we haven't gotten different results. So we think it takes moonshot thinking, thinking outside of the box, setting very ambitious goals, doing things differently. And again, likely society-wide efforts, not just one person, one company, or 2 companies, but society-wide efforts. So we are trying to encourage people to take this type of a moonshot thinking approach to addressing chronic disease. So what's happening in this conference? Again, we will focus on the chronic diseases, and we have 4 key sessions coming up over the next 2 days, today and tomorrow, Thursday. The first session, which is today, is making of a moonshot, and excluding myself here from the slide, remarkable group of healthcare leaders and experts. You've already been introduced to some of them, but I'll just pick 1 or 2 here. Dr. Troy Brennan is the Chief Medical Officer of CVS Aetna, and then maybe Dr. Antonin Nguyen, Chief Medical Officer from Anthem. Just 2 examples of remarkable healthcare leaders who I'm sure have a lot to share, what they are doing, what they are seeing, and what they think it takes to address some of these problems that we are looking to solve here. So that's the first session happening today. Then we have a second session that will also take place today, Wednesday. It's called Turning the Tide on Obesity, so focus on obesity. Again, a remarkable group of leaders, and I'll just pick 1 here. Dr. Dick Migliori, who's the Chief Medical Officer of United Health Group. And I very much personally look forward to learning from this group of experts. And then we have 2 more keynotes and panel conversations. The next one is the Winning the War on Type 2 Diabetes, perhaps my personal favorite of these 4 sessions. That's happening tomorrow, Thursday. Similarly amazing lineup of experts. And then last but not least, we have the 4th panel that is taking care from hospital to home. And obviously technology, telemedicine has enabled this transitioning and even better outcomes or similar outcomes in a virtual and home-based setting at a whole new speed. And again, amazing lineup of leaders, and I'll just mention here Dr. Ken Yamaguchi as an example. He's the Chief Medical Officer of Centene. So those are the 4 panels coming up. I'm very excited about the 2 days ahead of us, and hopefully you'll enjoy the show, and please participate actively, ask questions, and let's make it a good show. Again, here's the agenda: 2 sessions today, 2 sessions tomorrow. Thank you so much.